In Toronto, crews preparing for the worst. A field hospital under construction as the specter of a third wave grows.
We always want to be ready. As things begin to escalate, we can certainly escalate.
That escalation already being felt, says this ER doctor.
Today on my shift, I've seen more cases than I've seen in the last month.
Ontario's case count, once declining, is again on the rise while restrictions are being lifted. About 30% of those new cases are variants of concern, more contagious, and the one first discovered in the UK, far more deadly, according to new research.
A lot of things that you did before that were safe aren't safe as much now. We have to assume that it's everywhere and out there now. People need to be careful.
That's what Sadia Beg has been doing for a year. On dialysis, she's at a much higher risk of a bad outcome with COVID.
More so than anything, I know my anxiety levels have risen quite a bit. I have had a panic attack, having to go to the hospital myself 4 times a week for dialysis.
ICUs across Ontario have remained under stress. More than 300 patients are receiving critical care.
You go into an intensive care unit anywhere in Ontario, but especially in our hotspots, and it is a war zone still.
One hotspot, Thunder Bay in northern Ontario.
We are in the worst situation we have ever experienced here so far in this pandemic.
That puts pressure on the province's already criticized vaccine rollout. The best hope that any third wave will be less deadly. Warmer weather helps too.
Everyone hold tight and really accelerate the vaccine rollout. Get all of the doses into people's arms, and then we'll get through this. And summer will be a great time.
It can't come soon enough for this Toronto area mom. Her son has autism. The past year, robbed of routine, has been tough.
I'm hoping that we don't go into a third wave. I don't know how I would be able to handle it.
Ellen Morrow, CBC News, Toronto.